Almost. There we go.
Here we are.
Let's see, we are officially live on all stations.
Yes, we are.
IG and Facebook.
Peace and welcome. Happy new day. Happy and healthy family and friends. Welcome to another episode. We don't stop.
Yes.
Happy new day with Ari J.
Number 25.
25.
25.
Still alive.
Mm-hmm.
Made it through the weekend.
Yes, it was a phenomenal weekend.
Yes.
And then ended with some beautiful rain this last night and this morning.
Yeah.
I love the rain.
I love the rain as well.
Yeah, I love the sun too, but I don't mind the rain when it's too. Yeah.
Clears.
Gives the opportunity to freshen up the air and create some negative ions to help freshen up life and all that's around us.
And the sky is so clear afterwards. And then the blessing is a rainbow.
Yeah.
If you can get one of those. I love rainbows too.
Oh, was that right?
Yes.
Oh, okay. Well, I love the pot of gold at the end of the rainbow myself.
Yeah.
But I enjoy a good rainbow too.
Yes.
Yeah.
Indeed. So we are talking today about mental health.
Yes, I know that we initially spoke on touching on sexual dysfunction and sexual enhancement. We'll table that to Wednesday after our Tantra Tuesday talks tomorrow. I'm sure people have quite a few questions after that. Also, we were, for all those that weren't aware, we were certified as Talk Saves Lives presenters over the weekend. Yes. And they're a volunteer organization, a volunteer initiative associated with the American Foundation for Suicide Prevention. Mental health is something that's always been near and dear to our hearts. And it was something that we wanted to, even though it's not a direct part of, our everyday, or hasn't been, we wanted to be able to be of service to those that are in need, because it is a major issue that is spreading across our country, across the planet. Yeah.
Yes, and thank you. Major gratitude to Sister Simi Blair for the choice of us to participate in such a dynamic, to do this. This volunteer work, goes a long way, and we look forward to doing what we have to do.
Yes.
Because we do what we have to do.
Yes, absolutely.
We're doers over here.
Indeed, because there's such a tremendous need. I think that they said it was suicide was the 10th largest or 10th leading cause of death, and that leads to over, I think it's 800,000 people die by suicide yearly. So that's like a person every 4 seconds. When the trainer, she broke that down, I was like, wow. Yeah. And and the thing that where it circles back into our space is that it was found out that a majority of the cases were due to some sort of mental health challenge that had gone unaddressed. Yeah. So you got over 800,000 people a year that die by suicide. It's the 10th largest. Okay. Yeah, right on. Yeah, it's the 10th largest or 10th highest, 10th rate of death here across the globe. And a majority of the cases are a result of mental health. And what most people don't realize is a majority of the mental health challenges are due to a hormonal imbalance. Yeah. And so that's how it kind of comes full circle back into into our space, because we're talking about hormonal imbalances, we're talking about a mineral imbalance, and so what a situation may seem, almost impossible to deal with, when you add in an imbalance in addition to that, it just takes it to a whole nother level. And so that's something that, it really brought it home for us, because, it's just so many people that, they feel like they don't have hope.
Right.
And then, they look at suicide as being, the last resort, but the only feasible answer, and what's left for them, as far as an option. Honestly, it's not an option. There's always a way out. It's just that, having the resources or access to, the resources to help pull you out. That's where the need is, and there's a lack thereof. And so what brought us into this space, what brought us into wanting to become, volunteers with Talk Saves Lives and the American Foundation for Suicide Prevention, is that we wanted to become, add in, we wanted to become resources for that. We wanted to, do our part, because everybody, I'm not saying everybody, but a lot of us, we know of individuals, that have, died by suicide, or at least committed. I've experienced it a number of times, in situations where I've come across people that were in the process of an attempt, or know of individuals and have talked people down from suicide, or know of people that I heard about after the fact. And so, and a lot of the times, they did what they did because they felt like they had no option. Mm-hmm. And so, and then when coming to the knowing that it's more times than not, it's due to some sort of mental health challenge that can be attributed to a mineral imbalance. Mm-hmm. Yeah, I mean, like I said, just like everything else, it's preventable. It's preventable. And so we're, as suicide Talk Save Lives presenters, will be able to, plug into the mental health community here, and spread the word. And we want to really take it to the next level as far as establishing education programs here in the metro Atlanta area, and being a conduit to, really, go out, and speak to, the individuals that are in need, whether we're talking about the elderly, whether we're talking about the youth, and, everybody in between. Mm-hmm. Yes. What was something that came about during the training that you didn't know about before?
How important the environment of the person who is contemplating suicide is, having adequate carbon monoxide detectors, and the importance of gun safety.
Oh, yeah.
Half of the attempts or the deaths by suicide are by way of firearm. So firearm safety is very important. Mm. Those are two things for sure that I picked up on, and how important the phrasing surrounding the attempt, or, using words like committed, commit is...
the trigger words, yeah.
Yes,
yeah.
Commit is, that leads to, like, you commit a crime. Mm-hmm. Like, little words like that. Like, we have to be very careful with our words, period, but especially in sensitive situations such as that.
Right, mm-hmm. Right, yeah, that was something that stood out for me too. Mm-hmm. The words to use versus the words not to use.
Right.
Mm-hmm. Mm-hmm.
Yeah.
So what was it? The words not to use were committed, success. So committed suicide, successful successfully committed suicide or successful suicide attempt, or what was it, success or failed suicide. So those are more like judgmental words, and it puts that stigma on, a situation that's already, especially when you're talking to somebody that's, in that space, or presenting suicide as an option. And so those are things to kind of, steer clear of. And then when you, the words too that you should use when addressing somebody that's in that space, that's, in a suicidal mindset, is, use words like died by suicide, or ended their life by suicide, or or suicide attempt. And so those are less triggering when you're talking about that, or even when you're dealing with people that have already, been in that space, and it removes the judgment stigma from that. The one thing that really stood out to me was having an understanding of what sends a person, or what could send a person over the edge. Yeah, and so when the instructor, when Nancy, she broke it down, she says, when the pain supersedes reason, when the pain supersedes reason, and it really, that really drove the concept home for me, because, I've been there. I've been in some real dark times in my life, multiple times, where, I was really like contemplating, like, is life even worth living? Do I really want to be here? And in that moment, when Nancy broke down it took me back to those times. And each time, the pain that I was experiencing did not exceed, my reasoning for needing to be here or wanting to be here, or didn't supersede my ability to tap in on from a logical standpoint. And so I look back at with my oldest daughter. She's 31 now, so I think I was 19. Yeah, 19 at the time, and actually 20. I was 20. And her mom and I were going through this major ugly breakup. Ooh, it was ugly. That was one of the darkest moments, of many from my childhood and youth. That, when I really was like, with the recession it hit, or lightweight recession and whatnot, just trying to make it, struggling, and, that was the first time that I really looked at, like, I don't, it would be easier if I was gone. But then reason kicked in, and then I had to think back to, and actually the deciding factor was I did a reasons not to be here list and the reasons to be here list.
Powerful.
And the number one reason that I had to, that superseded everything else is, I needed to be here for Sharif, for my number one. I was like, can I ever imagine, not being a daddy and not being there for her, and and that was the deciding factor on, I need to go press through this and keep it moving, had I not done that, had I not pressed forward, I could have easily, walked away, and then, but the pain that I was experiencing, did not supersede reason. And so what does that look like in a physical realm? Like in comparison. Say, for instance, a person was just they fell off the side of it. They fell off. They had a major fall, and their leg is broken, snapped in half. They were in a car accident. The leg is snapped in half. That pain that a person is in that moment, can you walk up to that person and be like, oh, hey, and start asking them to reason in that moment? And asking them, like reasonable questions. They they're in agony. And they're like, in their mind, they're dying in that moment, because of the excruciating physical pain. And the pain that would lead a person into a situation where they feel suicidal or want to actually go over and so within that, you're asking the person like questions like, where do you live? What time is it today? And things of that nature. They're like, man, I'm in pain. They can't hear anything you're saying, and they can't even hear it themselves. They're just like, I just need to get out and remove myself from this painful experience. And so when you look at somebody that's in a state of, they're in a state of being in a state of suicide, suicidal thoughts and whatnot, whatever that pain is that they're experiencing is at such a high rate that reason goes out the door. Especially when you start to add in other, like outside substances like alcohol or drugs and stuff like that. Now, whatever inhibitions that would have normally kept them from, going over, taking that next step and fully, ending their life to suicide, they, now that there's no resistance. Yeah, and so that pain from suicide, and so when the instructor broke that down, that was a game changer for me, because I was like, whoa, yeah, and it made me look at it differently, because I'm like, yeah, I done had some broken bones. I had flipped 7 times when I was 12 on a ATC, and I separated my collarbone. Broke my wrist, had a concussion, had a big gash at the size of my head was busted wide open. Oh, it was nasty. And the only thing that I couldn't think. I was in so much pain. It was, I just want to remove myself from this painful experience. And when you look at suicide or people that attempt suicide in that fashion, yeah, that's where they're at. They are in such a dire situation of dire straits. The pain is so real for them that there's no other option. They can't. Their all logical thought is gone. Only thing is, I need to get rid of this pain. Take me out of this painful position. I can't take it anymore. Please relieve me of this pain. And that was the change. That's what really drove it home for me. And, and you look at people, and I realized that, a lot of times, the whole Talk Saves Lives platform is, people got to talk to folks. Because you never really know what people are going through. People wear these masks, and you can't see, they don't let you see what's inside.
She seemed so happy. He seemed like he had it going on.
Yeah.
And I will step in for just a moment, because it's important also that we share the hotline number.
Yes.
Okay, so I'll say it a couple of times, but the hotline number for suicide prevention is 1-800-273-8255.
Yes.
Again, that's 1-800-273-8255.
Absolutely. And then coming up soon, which I thought was really long overdue, but I'm glad they're finally implementing it, is that 988 number.
Yes.
So it's the suicide prevention equivalent to the 911. So that'll be coming on board sometime. I believe it's mid-July. I want to say the 15th or 16th. It'll become national, as far as you can in all 50 states, where you can dial 988. A person can dial 988 and get a suicide prevention counselor right there on tap, just like they would get a 911 operator. And so I think that that was solid. So, 988, oh, July, somebody says, oh, hey, hey, what's going on,
Peace,
girl?
peace, peace. Thank you, thank you, thank you, thank you, thank you.
Oh, yes,
All
yes, all
praises
blessings.
to
Thank you
Simi.
so much for
Thank
bringing
you.
us into
Yes.
this space. Yeah, so July 15th, the 988 number goes into full effect. So definitely, share that with anybody that, they may be in a situation where they might not feel like they're comfortable talking to somebody they know, but, they're able to reach out to reach out to a trained professional that can help them deal with the situation that they're in.
And we are volunteers.
Yes, we're definitely volunteers in the space, and our job is to create awareness for the services that are available, and then also create like a just baseline education and understanding on what what a person that's in a suicidal space, what does that look like, and how to recognize it within yourself and then others around you that you love, so that we all can be conduits and be of assistance in some way, shape, or form. Because a lot of times, like when I was in positions, but I felt like I was in that space, it was because I didn't have nobody to talk to. I felt like I was on an island. I felt isolated, and so being able to talk and share with someone, anyone, just to know that somebody even cares, that just means so much. That means, yeah, so much. And then also there's a text line, so a person can text to 741-741. So that's 741-741, and that will bring up a counselor, a suicide prevention counselor right away. And so we've got the 800 number, so that's 800-273-8255. We have the 988 number that will become available nationwide on July 15th. So 988, and it's like the 911 version for suicide prevention. And then they have the text number, the text line, which is 741-741.
Yes.
Mm-hmm.
Yeah, that it was a good session that we had.
Yes.
Definitely got us prepared for the environment that we're going into.
Yes. No, absolutely. Absolutely. So we're really, really, really excited to be able to go out and connect with the community, and be able to present and help and be a conduit for bringing more resources into our into Metro Atlanta. Let's see. Simi says we'll be reopening our new participant training on September 2022. Okay, so yes. So for those that are interested in becoming presenters, doing their part. I mean, there's many different ways to plug into the system. We like to be on the front line, and so that's why we chose to be presenters. But there are many behind the scenes, ways to volunteer as well. But for anybody that's interested in presenting, there's an availability of, we'll be reopening, the Talk Saves Lives initiative will be reopening in September for anybody that would like to become presenters and whatnot. And so, that's just something to be, to look out for. Yeah.
And Talk Saves Lives is in every state.
Yeah.
So you can participate.
Yes.
Because it's in every state.
Yeah.
Yes.
Absolutely.
Yes. Come on board and be a blessing.
Yes.
Be a blessing. Be a blessing.
Because you never know. You never know who's listening on the other line. You never know, a simple hi or a smile, could change the trajectory of somebody's whole day. Actually, their whole life, the family's life. Because when you look at, we're talking about, suicide or whatnot, it not only affects that person, but everybody that was associated with them. Because we all, and so
we're
it's
a tribe of tribes.
Yes.
And wellness is dimensional.
Yes.
and mental is a dimension of wellness. So it's so
Absolutely.
important for this talk stage lives because there is a demographic that does need to be reached and touched. So as I said before, wellness, you know, we can talk about food, we can talk about exercise, we can talk about all these things, but mental, everybody is not running around with sunflowers and and grapes, you know, but you know, it's important to look at the other side as well, you know, and mental is a very, very, one of the top parts of our daily living because our minds, like they say, a mind is a terrible thing to waste.
Absolutely.
You know, so where our thoughts are, where our feelings are, and everything that goes along with that part of our well-being.
Right. Let's see. Tassanet said, Ankh Rising. We need this in the Black conscious community because, especially in the Black conscious community, because being in that space, pretty much we've already all taken the red pill. And so we see everything for what it really is. And I'll admit, there was times when I was like, when I really came into the understanding of what's going on and what we're really up against, man, that can wear on you. And I've heard, and I listened to a lot of, our peers. They've given up hope because it just seems like such a daunting task that, yes, Tassin, yes, even more so for folks in the Black conscious community because they've already taken the red pill. They see they know what time it is. They know what we're up against. And sometimes it just gets to a point like, man, this ain't gonna never end. When does the struggle go end? And and it's like, I can't do it. Yeah. So yes, we do. We absolutely need to talk about it.
Definitely.
And Rita says, saving lives, mind, souls is the business. Yes, absolutely. Let's see. Deborah says, we sometimes have to learn how to recognize when our brethren are low-minded. Some folks can be acting happy and and when it's only masking the deep sadness. Yeah, absolutely.
And we never know. We come across people every day. What was going on in their home before they left? You know, everybody isn't cheerful and happy in the morning. You know,
Right.
and you never know. And even our own language in the home, not being judgmental, because there's teenagers listening and parents are saying, X, Y, and Z is this and that and blasphemy. Like, okay, that's indirectly judging that child, you know, and the demographic for suicide, from 10 to 34. No, it's high on the list for people who are young as well.
Yeah, they're the highest.
For people, because their coping mechanisms are not solid yet, you know. So if you have parents or grandparents or aunties or uncles or whoever they look up to that are indirectly judging something that's going on in their lives instead of being catered to a more listening ear, the child really feels like they have no one to speak with. You know, and even if these numbers that we share, the 1-800 number, the 988 number, even if these are on the refrigerator,
Yes,
the child can go and talk or whatever. Whatever you can do just to keep the environment, like as I was saying before, as safe as possible. You know, keeping medications away. You know, because too much of anything would be too much, you know, so keeping medications at bay or
I walked
your
in
own
a situation like that.
and it's very unfortunate, but
thank God I walked in on this. Yeah,
Exactly.
Yeah. But yeah, that what was it? She was trying to use pain pills. That's what it was.
Yeah, pain pills. I've seen someone take a whole bottle of aspirin. Too much of anything is too much, you know. So those medications, those are something to look into too, as far as their access to them. You know?
And a lot of times what people don't realize is that many of the medications, in particular, the really strong pain relief medications, depending on the person's condition. When we speak on mineral imbalances, hormonal imbalances, they're usually brought on more times than not. They're brought on by the medications that a person's taking, and so that's something to be. If my rule of thumb is, if there's a warning on the label that speaks to that, I chalk it up as it causes that. It has. The reason why they put those warnings on the labels is because the companies got sued for it. And so they were like, okay, well, we put a warning on there, like it could, this medication could do this and it could do that and it could. No, it did.
It has.
Yeah, it has. And there's a high probability that could happen to you too. So that's something to be aware of, because the situations that I've come across where I was brought into that space, more times than not, the person was on some sort of a real strong medication. Yeah, and it caused a chemical imbalance, and then it moved them into, or I'm not gonna say it moved them into that space, but it created that perfect storm that, you know, they kind of lost, and things were going on, from an external standpoint, and so the combination of the two created that perfect storm that, they felt like, hey, I don't have anything else left. Yeah, but then come to find out, when they actually went to be treated, the doctor said, oh yeah, they looked at the levels of, I forget the exact medication. In one situation, they broke it down like, oh yeah, they actually admitted to, like, yeah, this does cause that, or leads people into that, direction and whatnot. What's up, baby?
Oh no, I'm just listening.
Yeah. So that was what we were so excited about, our, training over the weekend. We wanted to share that with you all, and then what we learned, and, hopefully, especially, this being, we're going down towards the end of Mental Health Awareness Month and whatnot, that, this is a area that a lot of times doesn't necessarily get spoken on. It's taboo, especially in the Black community. But it's taboo, not only in the Black community, but across the board. Suicide, it has no color lines. It has no economic barrier to it as well. It's not a rich person's, challenge, or poor, lower people on the lower economic spectrum, challenge. It's a everybody type of thing.
From hood to Hollywood.
Yeah, exactly. From hood to Hollywood.
Okay.
That's something, this is something that, really needs to become mainstream, as far as, in our discussions, not necessarily just on TV or publicized, but just each one teach one, hey, how you feeling, brother? How you feeling, sister? That type of thing. And so, we really, that needs to be a part, are you good? Are you really good?
And being honest with the answer.
Yes.
Because a lot of times we lie.
Oh, yeah.
I'm fabulous. But I just had a horrible.
Like, no, you're not.
Me and my child just got into an argument. I feel like, I don't feel the highest right now, but I'm. But that's not really how you feel inside, So it's important not only to ask the people who are around us, or people on the bus stop, or whoever we come across, how are you? But also, when we are asked, be honest. Be honest.
Yes.
Yes.
Because if there's nothing else I really genuinely appreciate about being here in the South, is the connection that people have in general. Like everybody, I'm not saying they like wholeheartedly want to have a whole breakout session every time we talk, but just people are genuinely just friendly and happy and interested in each other, even post COVID. Because I mean, it's quite a bit different than it was back in the day, years back, but it's still, that loving environment. Like, hey, everybody says hey, highs, smiles, and how you doings, and and it really, it's a different vibe, coming from California, where it's sort of like, if I know you, I'll talk to you, but I'm not going to speak to you otherwise.
I'll talk anyway.
Yeah.
How you doing?
Especially compared to New York. There's nothing like New York. Yeah.
How you
It's
doing?
like nobody even talk. People even talk to the people they know at the time.
Mm-hmm.
Yeah. But just saying that, I could really appreciate that vibe about being down here in the South because, everybody's friendly, neighborly. Everybody kind of got that, it's a down home feel. Yeah. And so I can appreciate that. But say hi to somebody you don't know.
Do that today.
Yeah. Say hi to somebody you don't know. I mean, if you have to, even people that, that are in service industries, like the cashier. I can't tell you how many times when I'll be like, oh, hey, how you doing? And the cashier, damn, it was about to break down because it was like they felt some kind of way or validated that somebody actually cared enough to be like, how's your day? Yeah, and so the food services people, especially in the service industry, because a lot of times they have a tendency to feel like nobody really cares.
Yeah.
And they see all these people all day long, every day, and they're just there to kind of serve, but nobody really
invisible.
They don't feel validated. Yeah. And so just say hi to somebody. Mm-hmm. Hey, how you doing? That's all it takes. Hey, how you doing? Mm-hmm. And a lot of times you don't even know that may have been the turning point. Like, dang, somebody actually cares.
Yeah, and it can minimize a situation. I remember working and at a store, and a girl, she came up and she had you could just see the spirit on her. She just seemed so angry, and she came and, well, where is this and this? So I just sat and I let her finish, and I said, how are you today? Quenched whatever it was that was in her. How are you today? And you have to control yourself. You can't match it. I couldn't come back at her like she was coming at me. I can't match you on that. But how are you doing today? Mm-hmm. Then after that, it was a completely different transaction.
Yes.
Promise. Yeah. Mm-hmm. So we control our environment, and that includes how we interact with one another.
Mm-hmm. Absolutely. Absolutely. Yeah. So, to kind of bring it all full circle, yes. This is a part of our ministry now. So suicide, Talk Safe Lives, the American Foundation for Suicide Prevention will be doing presentations not only here our focus is going to be here in the Atlanta metro area, but we're available anywhere, across the country. We travel. So we start our traveling tour next month. We'll be in Jamaica, man. In Jamaica, but anywhere where someone has an ear to hear. If you're interested in us coming into schools, retirement centers, the workplace, you're dealing with people in attorneys, people that are in high stress environments. They need to hear this information. They really, you'd be surprised at what a presentation and just coming to the knowing of the services that are available. And so we just want to be a resource for all of those that have an ear to hear, to be able to present this information, and hopefully, you can take something from it, and then it'll save somebody's life at some point. Yes. Yeah, because knowledge, applied knowledge is power. A lot of times, people because they don't know this stuff exists, they don't realize that they have options. Yeah, so if that's something you're interested in, give us a holler, and we'd love to come through and do a presentation for any of your organizations, your churches, your schools, your community centers, your senior centers, you name it, your work, and for the employees. That this is something, especially if you work in high stressful work environments. This will be a way, because you never know. I mean, shoot, a lot of times that people mention it in a joking way, but we talk about people going postal. Yeah. People going postal. That's a synonym for suicide, attempted suicide. So that's real. It's real. More
Flight attendants, restaurant workers, everybody is. Everybody can be stressed.
Yes.
And no one knows a breaking point, so.
Yeah. And so here are the tools. Here's what's available to diffuse that situation. All right. Well, you have anything else, baby?
I feel like we did a good job today.
Yeah. No, you doing excellent. All right. Well,
yes.
I love you.
I love you too.
And we love you all.
We do.
All right, peace and blessings. Have a phenomenal Monday. Tomorrow, be on the lookout for the details, as we're having Tantra Tuesdays. We're going to be brought on as guests for the Too Much Moxie YouTube show. So it's going to be an interview, and we'll be talking about all things Tantra. It's going to be spicy. So when we're talking about raising the bar, living our best lives, tapping into our highest spiritual selves. Not to mention, and when you talk about improving your sexual prowess, it's something you don't want to miss. So tune in tomorrow. We'll have the details coming out, because we still haven't worked out exactly how we're going to do the actual broadcast between his channel and ours. But be on the lookout for that. That'll be out this evening. And I guess that's about it. I'm good. You good?
I am good.
All right. Well, y'all be good. We love you all. Have a blessed day.
Yes. Peace.